homeopathy physician specializing in mind technology, Dr. Tham has helped a lot of people, thousands, achieve healthier lives naturally without conventional drugs. I'm so sorry. As a founder of Videx Foundation, Videx platform, Dr. Tham is one of the forefront of holistic health innovation speaker and also practitioner. He has spoken across the region, including Singapore, Taiwan, China, and Indonesia, sharing his groundbreaking insights. In 2022, Dr. Tham was invited to present at a prestigious medical conference of over 500 doctors, highlighting the power of transfer factor in immunotherapy. Dr. Tham was recognized as one of the Malaysia's most successful individuals by British media publication, and his work inspires trust, confidence, and result. So without further ado, let us all welcome Dr. Tham on stage with 888 in the chat box as an applause to welcome Dr. Tham.
Okay. Thank you, Hui, for such a illustrious introduction. Let me see. Okay, I share screen first. Wait, just see how. Okay, I'm here already. Can you see the screen?
Yes, Dr. Tham, maybe put it full screen.
Yeah, put full screen. Yeah, okay. Okay.
Yep, all good now.
Okay. Good evening, everybody. This is a very important topic, and the reason why I chose this topic is CVD, cardiovascular disease, is number one almost throughout the world. Okay, and everybody is like a walking like a time bomb. They don't even realize. Okay, they think nothing will happen to them. So tonight I will share with you, if we don't take care of the plaque or plaque, you call it, something will happen to us which you do not know. Okay, so I will share something about dietary, something on lifestyle and supplements, and then to see help you. If you implement that, I believe your plaque should be slowly taper off and reduce. Although it's not easy, but it takes consistency and discipline to do that. Okay, so my next slide is, if you want to have a healthy cardiovascular system, you must have a healthy heart. If you don't take care of your heart, nobody will take care for you. If you have a faulty valve, if you have other heart conditions, you will not be able to function properly. Okay, and you only know when you are in the hospital bed, lying there, then you realize the healthy heart is so important. Okay, then you have to have healthy arteries. If an artery is blocked by plaque, you call it, you have arteriosclerosis, you will get heart attack, you will get stroke, you will get, cardiac arrest, and so forth and so forth. Then you must have healthy blood pressure. Your pressure must be well maintained, and most people don't bother. Okay, and then they have a highly tempered person, they get into stroke. So I'm sharing with you these three things must be in order. You want to live healthily, especially concerning your heart. Like I said before, heart disease is number one killer. Now even worse. Now, let me see. Now males, CVD is dropping while female is rising. Okay. Both male and female is number one as well. Okay. Will I take away the thing? I can't see it. It's no more a man disease. Okay. I quote to you this case which I shared with you many years back. 33-year-old professional footballer, baseball player died. Now autopsy showed 80 to 90% narrowing to 2 to 3 coronary arteries. Okay, so as important exercise is only part of the answer. So it doesn't mean you exercise a lot, you will not have CVD. Okay. Now even more worse. Since the COVID vaccine, many young people are getting affected. Okay, you have seen a lot in the Google, and you know, a lot of papers report came out. You know, now you see the amount people spend in US, you know, for heart disease is 240 billion. Heart disease, coronary heart disease is 111 B. Hypertension alone is 47.2 B. Okay, so imagine even for stroke 49.4 B. The total cost about cardiovascular is 329.2. This is an old figure. I believe now it reached about half 500 B already. Okay, so you see how much is spent on insurance. You see, 270 million people, about they spend per person is US 1,200. Now you look at the medical bills incurred by Prudential and this AIA. They spend almost $2 billion a year on chronic disease. That means to say it involves diabetes and heart problem. 2 billion each company. I have not even mentioned other company. I didn't really go and ask them. This itself tell you, you know, many people are going through that, and without realizing, you know, they got medical card and they pay for it. That's all. Okay, so take care. You know, doesn't mean you have medical card you'll get well. So scientific study on the pathological determinants of arteriosclerosis. What is causing the plaque build up in the arteries and how early this has started? Okay, now autopsies have shown 3,000 people 15 to 30 years old die of causes unrelated to CVD. But they have also found that every 15-year-old already have plaque or plaque build up starting in childhood already. So it doesn't mean a person is young. The plaque build up is not there, you know. You think he's young, but actually it started already. So along the way, you know, you're not careful. That's why young people, their lifestyle is not so good, and then you see they have a lot of problems on CVD. Okay. Now I want to ask you a question: is cholesterol the cause of heart problem? Ask yourself. If I ask a question here, I can't see you all, but okay. Can I say take a see a chat room? You all can yours. What do you think of cholesterol? Is it, if you think it's a cause of heart problem, put 1. Not the cause of heart problem, put 2. Can I see a show of 1, 2, 2? Or not sure. I'm a fan. Can I have a show of 1 or 2? 1 means cholesterol is the cause. 2 means not. Can you type in? You don't know. Either you don't know or you. Okay, never mind. I'll just keep on sharing. Now, this statement, cholesterol is a cause of heart problem, has caused many people to suffer because they have to take a drug called statin, which I will explain later. And it has earned the pharmaceutical company $1 trillion over the last 10 years. Okay. So I'll go on and tell you what is the is it good or not good. Okay. Now, more than half the patient, the research reveals that more than half of all heart attack patients have normal cholesterol levels. And that's why the US FDA, they retracted the statement that cholesterol is not the cause of heart problem. So everybody I'm not asking to stop, not stop. Everybody who's on statin, consider carefully when you at the end of the talk, I will share with you all. Okay. So actually, the whole study states that inflammation is at the core of cardiovascular. Okay. Now there are some what causes of inflammation: homocysteine, free radicals, oxidized LDL cholesterol, and so forth and so forth. Okay, I don't want to go so detailed. Even if you are infected, okay. Now you see, if you are a person who have always get infected one, always fall sick, over the total infectious burden of a lifetime, that can cause repeated inflammation and result in cardiovascular problem. Okay, I have seen people who are in childhood they have a lot of sick problem, getting infected and falling sick, but at the end of their life they got heart problem. Okay, so please take note if you are a candidate like that. Heart conditions are many. I won't go in. You can go in Google. Heart attack. Okay, 70% of heart attack have no warning. That's why recently we have a few cases. No, it's just sleep, die in the sleep, or just come suddenly, and then they just collapse. Especially now after the Pfizer vaccine, we find that there are many people who collapse like that. Okay, so that's why I say we are a walking time bomb. We do not know. Okay. Now I just give you a bit of difference between heart attack, cardiac arrest, and stroke. So at least you know you come for this kind of talk. When you talk about heart attack, you have chest pain, very painful, squeezing pain, body aches, cold sweat. You have seen a person cold sweat and not breathing properly, shortness of breath, or he has diarrhea. Please rush to the hospital. Okay. Now, if a cardiac arrest will be blackout and loss of consciousness, okay, and extreme palpitation. Stroke is even worse. You see the person cannot talk really, disrupted speech, blur vision, confusion. She can't even figure out, what to say or not to say properly, and not able to walk properly. You see this kind of condition, please rush to hospital as well. Unless you know how to do it at home, you can put the pin on the ear, on the fingertip, and all these things. But I don't have time to go through all this. Okay. Plaque reversal. Tonight I will talk. What causes my plaque? Pre-diabetes, diabetes condition. Okay. My risk is off the table because I just don't eat many cups. If you eat less cups, your risk is less. Now you look at this table. Most never go and measure, If we are in range, it's less than 5.7. If we are 5.7 to 6.4, you may not be able to take up your insurance policy. But we can help you. I was challenged the doctor before. I was at 6.5. I challenged the doctor. Doctor said you need 3 months to reduce to below 5.7. But in a week, I already done it already. Okay. So more than 6.4 is definitely you are considered diabetic. And if you are in this kind of condition, plaque or plaque formation in the arterial walls is being formed. Okay. So that's why if you know you're diabetic, a lot of people don't measure. Please do a test on yourself, and record it down, because you do not know existing build, and then you are become a walking time bomb. Okay. Now, plaque reversal is not taking calcium out of the artery. It's not taking cholesterol out of the artery. It's about inflammation out of the artery. Now, inflammation can be due to many reasons. Can be due to stress. Can be due to, like I said just now, the infectious disease, and then your lifetime burden, you are burdened with many kind of infection. This will cause that over time. Emotional trauma, especially now with the latest the COVID, being infected also will cause inflammation. That's why a lot of people die of heart problem because of that. Okay. Now, let me explain to you very simply because I don't be make it so medical, you know. Now you see in the arterial wall, your endothelium, smooth muscle. This is called, if we put medical term is intima. This is smooth muscle and plaque. Now, what happened is this part, cholesterol can go through, no problem. Okay, but when the LDL landed here, it's being oxidized, like I explained here. The macrophage, that means the immune system cells, will go in and transform them into foam cells, which will accumulate and form hardening of the plaque. Okay, the process is a development of plaque build-up between arteries, leading to arteriosclerosis. When arteriosclerosis here is all arteriosclerosis. Okay, so inflammation will cause LDL to be oxidized. Okay, if you are always stressed, this will build up because, like I said, this process is being explained to you. So over time, you know, now with the spike protein also, you attack your arterial wall, your valve, and so forth, you know. So people who are done Pfizer vaccine, take note, you need to really detox it up. So cardiovascular is a metabolic problem. And because it's a metabolic problem, you develop plaque in multiple arteries. So it doesn't mean that it's one area. If you have a metabolic problem, okay, Seth, I'm talking. You go to the room, Seth. So you develop plaque in multiple arteries. Okay. So metabolic disorders is what? That means it can form when your organs like pancreas or liver don't work properly. And that's where you see like when your pancreas don't produce enough insulin or fail to produce insulin, what will happen? It will cause inflammation on the arterial walls. And because of what I explained earlier, you know, the macrophage will come in and then from there develop into all the plaques. Okay. Now, how to find the plaque? This is a carotid intima media, it's called CIMT test. Now, this is a very simple test. What the test do is they do an ultrasound. Just put on the neck only with some special technology or to test out. And then they will focus on the plaque. That's on the carotid. Because plaque is a metabolic disease, if there is a formation of plaque here, that could be also in arterial wall. So it's more than just measurement of blood flow. Stress tests will measure blood flow, but stress tests do not predict heart attacks. So people who have gone through stress tests and think nothing, you don't know. We really don't know. Okay, because it cannot predict whether you're going to have a heart attack. We really don't know. Okay. Now this is what you call intima. This is this layer, inner layer. Media is here. Media is muscles, where it regulates the elasticity of the muscle, the arterial wall. Media is where they deal with the metabolism function. This is what it does. You know, this is where the all the oxygen comes out, amino acid come out, and then waste molecule go out to the veins. So this is what will happen. This the intima, you know, the vessel, the inner vessel wall will deal with. Okay. Now, so I just give you a clearer picture. Media, intima here. Okay. Now, what the CIMT test do is the ideal thickness. That means the thickness between media and intima, okay? The thickness should be below 1 mm. If it's significant plaque, it's anything is above 1 mm. Okay, so you can do a test in any hospitals and you find that if your plaque is above 1 mm, you better do something because it's about life and death. Okay. You can do a calcium score. Is it a good option? It won't tell you about soft plaque. I will explain what is soft plaque. Okay. You can do a CT angiogram with AI, but this is an expensive thing, but you can see the soft and calcified plaque. Okay, invasive. And sometimes through this, you have to do a stent, because it's so clear. And maybe you have to do a bypass as well. This is what is CT angiogram with AI. Okay. There are two types of plaque. You call heterogeneous plaque, soft and calcified. And most of the heterogeneous plaque is mostly calcified. Okay, and a new plaque is homogeneous, soft, and deadly. Because the new plaque soft, but the outer layer is very thin. So if it breaks, it will form blood clot and becomes deadly. Okay, and then it results in heart attack. The other test you can do is homocysteine test. Okay, this is where if your level of homocysteine test is high, the blood test shows you are definitely short of B6, B9, and B12 deficiency. People with elevated homocysteine will have higher risk of heart problem, and it also may result in heart attack, stroke, and other heart disease. You can do a test also to find out. You have a lot of money, you're scared of your heart got problem, go and do a test. Okay, so I repeat again, it's taking inflammation out of the artery. Okay, the most important intervention is your lifestyle. You can't out prescribe or out supplement a lifestyle problem. If you take a lot of supplements, if your diet is good, but your lifestyle is no good, you go and drink, you go and don't sleep, you sleep 5 a.m., 6 a.m., and then you live unhealthily, you're gonna have problem. I have many people who lifestyle. I have a friend, when he eat, he really take a big bowl like Indians in India eat, every day eat like that. You just warn him, and the wife also warned him, but he never listened. And what happened? He got stroke. So please, this Chinese New Year, eat moderately. Okay, you can eat, but eat for flavor. Okay, not just eat any amount you like. Okay, this is some results to show that intervention lifestyle is very important. Now, how to stabilize plaque or reverse a plaque? Legs are the best safety valve against insulin resistance. And that's why you have to strengthen your legs. Okay? It's the best against insulin resistance. Your calf is called the second heart pump. No? You know that? Your calf, this calf here. Okay? So I just have something to tell you. Walking can reduce the formation of blood clots. Okay, and reduce the possibility of myocardial infarction. So do go and walk. It can reduce the accumulation of triglycerides or cholesterol on the arterial wall. So when you do a lot of walking, sometimes they carry the watch, you say 10,000 steps. Do it. Okay, whether you walk or you run, do it, do something. Because walking can also reduce hormones. So many things you can achieve. And you can increase your leg strength by doing squatting and all this, then you see your improvement. Another way you see people walk slow, there's a sign of longevity, they're aging. The people who are walking very fast, they live longer life. Okay, you can see when people outside, you eat, you walk, like no strength like that, then you see their life not so long. Okay, now how to reverse the plaque? or stabilize it, weight loss is very important. If you keep on putting weight, then you got problem. Sometimes you eat less is better than not than eating a lot. So maybe you want to go out with your friend, you eat half, some people don't like also. Okay, so you target, you want to lose how many pounds, you target. You can go for a run if you want. A lot of people will do high intensity, interval training. If you don't know how to do, get engaged with a coach. They will go through with you like resistance training and all this. How to reverse your carb? From low carb, I went low carb. I mean from low fat to low carb. Okay, your exercise is very important. Then you can start taking supplements, which is related to your heart. Okay. So the changes I made was from low fat to low carb. This is a bigger change. And there are a lot of people in other reports, when they do this, the plaque after 1 year become less and less and less. And the CMT test, instead of 1.3, it goes below 1. So they see the improvement. Okay, I don't know about you thinking of HDL, right? Low HDL sickness, insulin resistance. So if you have high HDL is okay, but not the not so good LDL. That means the poor LDL. So if you have low HDL, signal insulin means what? Resistance means what? You're going to diabetes. Okay, and then diabetes, that I said earlier, it will cause plaque formation. Okay. So what I'm concerned now is the COVID-19. It has increased the risk of heart attacks, strokes, and deaths for 3 years even after the infection. So that's why you see a lot of people lately. I don't know. I got so many friends. During a party, the ducting just collapsed. I have so many cases actually in my hands. And please take care if you are, especially taken the vaccine. Please take care. If you don't feel well, you got breathlessness. Please take care. You see the hidden Pfizer report that shows heart conditions in the vaccinated getting worse over time. This is hidden on this report. The people who after taking the Pfizer, the heart condition become worse and worse over time. So what to do? That I would talk about this in my next talk on vaccine side effects. And please come and listen, because invite your friends to come listen. You do not know you can save your lives, your friend's life. Okay. This is the memory of my late brother. My heart, before he passed off, he says, what do you say? My heart is not functioning well. Difficult to strengthen, need to go to for replacement. You know how much is one heart? A pump to replace a heart? Almost $1 million. When I read this, I couldn't stand it because I become helpless. I really don't know how to help him. This late brother of mine, he has done 3 vaccine, Pfizer vaccine. Okay, which I actually encouraged him against it, but he didn't listen. He's just going to do it. And you know what happened? His valve leaked. I believe the spike protein caused damage to the valve. Just like another case, the spike protein caused damage to the aorta valve, and the person died also straight away. So you see many people, if you're having not breathing well, people who have skin problem, or people who have what, please help them. Don't keep quiet. We have the means to really can help them. Okay, we have a cellular detox program. We can help them. Okay. Okay, I show you. This is the heart coronary bypass surgery. If you don't take care of your heart, please don't land yourself in hospital, and then you get this kind of problem. Okay. Hui, you just show something. Just show one.
Okay, Dr. Tang.
a cardiac surgeon at Northwestern Medicine at the Bloom Cardiovascular Institute. Our patient today has a large aneurysm of the aorta. We will be replacing the aortic aneurysm, and in addition, we'll have to repair the aortic valve. Please join me today in the operating room as we perform open heart surgery. Aortic aneurysms can be life-threatening if left untreated. John Ritter had an aortic aneurysm, which ultimately ended up being a life-threatening condition for him. So the purpose of this operation is to repair the aneurysm before it turns into a catastrophe. So we've made skin incision. We've divided the breastbone, that's called the sternotomy. And we're opened up the wrapping around the heart called the pericardium. And here you can see a large aortic aneurysm measuring more than 5 centimeters. So this tube of aorta is too big, and this is what we mean by an aortic aneurysm.
Right now we are on pump, meaning that the heart-lung machine is doing the job of the heart and the lungs.
So the heart is completely still. This will allow us to open up the chambers of the heart and operate on the diseased valves within. Okay, cold pour, please.
That's going to help us cool the heart all around it, which protects the heart during the surgery while the heart is stopped. This patient has an arrhythmia called atrial fibrillation, which happens when there's abnormal electrical circuits inside the heart. This causes irregular heartbeats and a higher risk of a stroke. Part of our surgery is called the MACE procedure. What we do is we create scar tissue in the heart that will interrupt these abnormal circuits of electricity to stop the atrial fibrillation.
We're using a cryoprobe to create scar lesions in the non-pumping chambers of the heart. And this probe gets pretty cold. It gets down to minus 150 degrees Celsius. All right, we got a lot of work to do here. We're gonna replace the aortic aneurysm with this Dacron graft. And this Dacron graft is woven polyester, and it's constructed as a tube. So instead of the patient having a large aortic aneurysm as a tube, they'll have this Dacron graft tube. The heart is a very efficient pump. It'll pump approximately 1 million barrels of blood. And in order for the heart to work efficiently, all the valves have to work in a correct fashion. For this particular patient, the valve closing is inefficient, which allows the blood to leak backwards in the heart, and this will eventually lead to heart failure if left untreated.
We have to operate on a part of the aorta that we cannot reach when there's blood going through the aorta. To do this, we have to stop the bypass machine, which we can only achieve by emptying the patient of all his blood. To be able to do this, we have to bring the patient's temperature down and give a good dose of anesthesia. It causes the brain metabolism to drop down to minimum. That's why the faster we do this portion is going to be the best.
So I'm looking at the aortic valve here. You see 3 leaflets. As expected, they're overstretched from the aortic aneurysm. So what we're going to have to do is to reduce the length of the leaflets. Next step is to put the coronary arteries back on the Dacron graft and then sew the 2 aortic grafts together. So I'd say the next hour is going to be a lot of sewing to get this back together. Before we've completed the repair, so we're giving a solution to help wake the heart up before we release the aortic cross clamp. Once we release the aortic cross clamp, a lot of times the heart isn't in a regular rhythm, so we have to shock the heart. So it's a lot like the CPR you see on the TVs. Anatomically, we thought that the repair was a good one, but we're never really sure until we see how the valve functions in a physiologic state. Dr. Aaron Reynolds here, who's an expert in transesophageal echocardiography, sees that the valve works normally and all the aortic leaking is completely resolved. So we're very happy with how the valve repair turned out. We're off heart-lung machine now, and you can see that the heart is functioning normally. We've fixed the aortic valve, we've taken care of his atrial fibrillation, and we're about ready to close up the chest. Being a cardiac surgeon is a tremendous responsibility, but it is extremely gratifying. We love seeing our patients recover after surgery and eventually return back to normal life with a well-functioning heart. The procedure went great today. We'll be recovering the patient in the intensive care unit overnight. We'll continue to monitor him for the next 5 days, and I think he'll make a great recovery. Thank you for joining me inside the operating room. Hello, my name is...
Yeah, I didn't mean to let you see go through the whole video, but you see, if we don't really take care, I really hope, I do not want to see anybody to land himself in hospital, because if we are in there, this is what we will have to go through. So the message is very strong for all of you, especially as we age, especially if we don't take care of our diet, we don't exercise at all, and we don't take any other supplements to take care of ourselves. And we have high blood pressure, you don't measure, we have diabetes, you don't control, and then you have hot temper people, you're more likely to get stroke than anything. Okay, recently we have one in Malacca who got stroke because of being hot tempered. So please take note. Where's my sharing screen? I haven't finished yet. Wait, I come back to you. There's my slide. Okay, I just want to share very fast and then I will go. Okay. 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 It's not this slide. Wait, let me see. Please give me a minute. Oh, I didn't see my slides. Wait. Oh, yeah. Wait. Bye. Okay. Can you see the slide?
Yes, Dr. Tham.
Yeah. So just now I was sharing about statins. A lot of people use statins to control cholesterol, right? So let me share with you, what is the actually statins about. Actually, statin was introduced to reduce inflammation, but they also claim that statin can reduce cholesterol. And what happens is people who are on statin, they will also cause artery calcification and mitochondrial toxins that impair muscle function. That means to say, statin will reduce the coenzyme Q10 in the heart muscles. That means to say the depletion of coenzyme Q10, the heart will become weaker. And that's why we call heart failure, and it will build up plaque as well. So lately, the study on statin was also it will cause Parkinson's disease. So please, I'm not advising you to stop. Please go back to your doctor. Plus, in fact, like I say, cholesterol is not the cause of heart problem. Why go and take? I should understand. All right. So you consider, you run your own life, go back to the doctor and ask them, because the doctor, definitely want to give you, because that's where you can make money. Okay. So please consider carefully, because this is one statement that FDA has already withdrawn, that cholesterol is not the cause of heart problem. These practical tips I won't go through with you unless you come from my health camp. I'll teach you how to, if you really have a heart attack, how you control yourself, how you manage it. Okay. Now there are many studies which say that if you take enough supplements, it will help you improve your heart health. Okay. So let's say this is something I found, this CB, this cardiovascular and targeted vitamins. This is the world's patented heart formula. You can go out and find and let me know which is a good heart formula. There are many ingredients inside there. You see, many ingredients: resveratrol, coenzyme Q10, ginkgo biloba, hawthorn. Hawthorn is to strengthen the heart. efficiency in the heart. Your heart is weak, take hot on. Okay. You have butcher's broom, we should reduce the plaque. You have red yeast rice, international herb for reducing cholesterol. You have B6, B9, B12. You address homocysteine level. So you see, that's why you say this particular product, world patented heart formula, is good for hypertension. Your high blood pressure, try. I've helped many people already. High cholesterol, try. Stroke, people who have got stroke and then after they take, they improve. Arteriosclerosis, we have a bypass also, one case in KL, I think. He actually avoided the bypass. We also have fatty liver, we have helped before, blood clots and so forth and so forth. So this is a very good heart formula. I take every day. In fact, now I take, because of so many heart cases, I take two twice a day now. Okay, I don't want to get involved. I see people just collapse and go off of that. Okay, if you value your life, take care of your heart, okay? And I'll talk about inflammation. This particular product is, I think, only the product in the world that can reduce inflammation by 64%. I take this also 3 a day because I know that inflammation will cause build up of plaque in arteries. So I take. Okay, so they also improve detoxification by 43%, reduce oxidation by 42%. Okay. Then we have fish oil, which is very good for heart. We have ratio, very good, perfect ratio, omega-3 and omega-6. We have all the deep sea oil with us, and you can go and study. I just recommend to you lah. This is what I find very good for. I take 2 a day now, 2 a day, yeah. And then we have this powerful and unbelievable transformation to wellness from our cellular detox program, to help you in slimming. Remember I said earlier, slimming will help you to reduce the plaque. You see, this program can increase 150% detox because of the glutathione. This will help you to, this is a principal detoxifying agent in the body, also muscle antioxidant. So you do this, you will also help you clear the spike protein as well. I believe very much because of what glutathione can do. Okay, you burn visceral fats 564%. One way to reduce plaque is also reduce the fats. Okay, reduce oxidation means reduce cell inflammation by almost 43%, and then can balance the immune system as well. So this is a very good cellular detox program. If you want to know more, ask the person who sent you, invite you in, and then ask them. And this year we do this cellular detox program. You see, he lost 7.5 kilo. His 40-year diabetic medicine also stopped. So people who are diabetic, people who are high blood pressure, do the detox. Especially you see him very fat, obese. And especially we ask him, we do the three doses of Pfizer vaccine. Please ask him to do. Okay, never hesitate to ask him. And this lady, after the talk, you see, he has high blood pressure, he has so many problems, hormonal imbalance. You see, he slimmed down, become beautiful already. He's a facial, See, this fish, with a lot of eczema. Now she did a detox and become slim and beautiful again, the skin. So I have many cases like they become younger also. So this detox program is very good. I will end here because if you want to ask any questions. Any question to ask? I charge $500 per session. I give free advice. You all don't want to ask. Can ask anything, no problem. If I don't answer, I say I don't know. Anybody in the chat room want to say anything? Any question in the chat?
Not at the moment, Dr. Tham.
Okay. But my advice to you is please take care, because as we age, and the plaque is building up, especially with all the stress in life, the cortisol increase, diabetes will come, because you see, I give you an example, when we go to, or where to get a supplement you mentioned, or who invited you in, you can ask the person, he will share with you. Sometimes I have congestion feeling in the heart after Pfizer. So we can help you. Sulin and another lady will ask. Yeah, any remedy besides what you recommend? You can take juices, resveratrol, all this, but because this cardiac formula I gave you is, they are all centered on the heart. The vitamins are for the heart, magnesium, all these are for the heart. And they have all the heart formula herbs all inside there. I study every one of them, the ingredient. If you take, you feel very good. If you just say the day you don't feel very well, you take two, you come back and take two, your heart will feel better one. I wish I can do more on the heart exercise and all this, How to clear heart calcification, please. So this will take time. But heart calcification sometimes is a good thing, because if your heart calcification is strong, it's stable. It will not break away, So what we want to see is not unhealthy calcification, but if it's steady calcification, it's okay. Okay. So what we want is to take away the inflammation. Any questions? Especially our parents, take care of them, really. Once they have stroke, all these are very troublesome. With no questions, I will wish you really Happy New Year, Chinese New Year. Take moderately, enjoy yourself. You can also enjoy, but don't abstain totally, but you can go and enjoy lah. Eat. I eat also, I don't simply eat lah. I mean, go for flavor lah. Question. Irene, got question? Who can?
Dr. Tham, there's one question. How do we know whether our heart classification is steady or not?
You have to do the calcium score, I think, which I mentioned just now, calcium score. But if your calcification is stable and strong, then it's okay. Only that the new plaque, that is quite dangerous one. Just for newly formed, because it's not calcified properly, and because the plaque, the wall covering the plaque is very thin one. You can break. Once you break, you form plaque clot, and that's why people get heart attack because of it. Okay. Come for my next talk on vaccine side effect. Then you'll be scared when you hear the talk.
Dada, we have one last question from Ms. Chua. Can start prescribe oral statins to high blood pressure patients?
Can. Why not? I already stated, cholesterol is not a cause of heart problem. Statin will cause reduction of coenzyme Q10. It means cause ATP in your, that means the activity in your mitochondria. That means the heart no strength one. And then it will cause arteriosclerosis, proven. At the end of the day, you also, latest study I saw was also cause Parkinson. So why pay for yourself where when you see a lot of people who die of heart attack, they are not cause the cholesterol is not high one. So and then the FDA already withdrew the statement and said that cholesterol is not the cause of heart problem. Why people still taking? I don't understand. That's why I'm in holistic wellness. I dare say I'm telling you, because don't need. As long as you take your lifestyle properly, you take a right supplement, you exercise well, lifestyle good, your cholesterol all will drop, everything drop. You do the cellular detox program, all will drop. Why want to take something to harm yourself? Okay, you have a choice, you have alternative. That's why we give this kind of talk. I wish more people can come in and listen, and then they know the way to, rather than always go and see doctor and then give you all this statin, steroids, and the antibiotics, which is not really going to help.
Dr. Tham, we have one question. Which TF product to take instead of statins? I think it's statins.
CB, You see, CB, the ingredient for CB has got the red yeast rice. Remember I shared with you just now? Red yeast rice is an international herb for reduction of cholesterol. Actually, HDL is very good. Those which are low in HDL, as I said earlier, are prone to insulin resistance. Insulin resistance means they will lead to diabetes. So high HDL is okay, but not the low LDL. That's not good. Because once it's oxidized, right? Oxidized means what? Let's say you go to emotional trauma, the stress, there's a lot of free radical, and then it will oxidize the LDL. Then it will stick to your arterial wall and then become plaque. Just like people who have a lot of stress, why they got heart problem. People with emotional trauma also heart problem. Because of these reasons. Okay. It's not about cholesterol, it's about inflammation. It's like I begin the talk that the core of cardiovascular disease is inflammation, not cholesterol.
Okay, Dr. Tam, from Lee, another question. The olive oil detox helps to lower plaque since it improves the liver function.
Olive oil,
Olive oil detox.
then why don't you do our cell detox? Olive oil will only reach the liver. That's what we call a single organ detoxification, or you reach the liver or kidney only. But IDX, the cellular detox program, will hit all your cells. The cellular detox program. Why is able to do? Because of the glutathione. Glutathione is a principal detoxifying agent in the body, and you cannot find anywhere because it's the master antioxidant as well. So that is 150% detox, no? So there's a lot of people who do this, their health problem improve, the liver fats go off, the diabetes, as I shared the case, 40-year diabetes drop. I have a lot of high blood pressure people who did also drop, skin problem improve, so many things. Especially if you're on Pfizer vaccine, I highly encourage you to do. Okay, because you've got other formula that can filter out those spike protein. Very difficult. But I will present it in my vaccine side effect talk. I will show you other therapies as well. Then you will come to the conclusion which one is the best.
Yep. Okay, Dr. Tam, I think so far there's no more other questions. So once again, thank you very much, Dr. Tam, for your valuable time in sharing us this very important topic tonight. So we will look forward